Okay, well, good evening, everyone. I want to welcome you all to this Metropolitan College of New York town hall on COVID-19 and its impact on minority communities. I'm Dr. Phil Nufrio. I'm a full-time member of the MCNY faculty and co-chair of the Faculty Council, which has co-created this event with Professor Dominic Boyce, the New York NAACP, and Natalia Sucre of the MCNY Library. Before I turn the town hall over to Professor Boyce, I would like to ask our MCNY President, Joanne Passaro, to open up with a welcome, followed by our Chief Academic Officer, Humphrey Kirkendale.
Thank you, Phil. It is my honor to welcome all of you to this virtual town hall, focusing on the facts and myths surrounding vaccine for COVID-19. This is about racial justice, and it's a topic that's extremely important to MCNY students and the communities we serve, all of which have suffered disproportionately from the pandemic over the past year. It is critical to us at MCNY that part of our work is to safeguard and protect the members of our communities, and this town hall aims to provide you with the information that will help you make informed choices for yourselves and your families. I would like to personally thank our moderator, Professor Dominic Boyce. There was a picture of me getting my vaccine at Harlem Hospital, which he made possible when I became eligible. He has done a lot of work getting the vaccine into our communities, and I would like to thank our very esteemed panelists. We are honored that the four of you are joining this conversation. Thank you too to Phil Nufrio, Humphrey Kirkendale, and Natalia Sucre. Humphrey, take it away.
Thank you so much, Dr. Passaro. I want to join the president in welcoming Dr. Powell, Dr. Yassera, Dr. Didion Phillips, and soon to be Dr. Aliyah Dumas to Metropolitan College of New York. A significant part, more than 50% of the student body at Metropolitan College are women and women of color. And I'm always happy to be in the midst of scientists who can share science and not facts and myths. I'm not altogether sure if this is a myth, but I have always been told that if you want to get valuable and credible information to our communities, channel it through our women, and our men will ultimately listen and hear. I don't know if that is true or not, but I am pleased to have all of you here to help to spread the word and to dismiss and to dismantle a lot of the myths and misinformation and disinformation surrounding this most important initiative of a vaccine, of the number of vaccines that are available. So we are excited. I am especially proud of Dominic. I am narcissistic. I hired him in the School for Public Affairs, and it is good to see that he has done such wonderful things. And if he wasn't a disciple and a believer in Metropolitan College, he will not have told his wife, come join me at Metropolitan. So I'm especially happy to have Dominic and to see all of the wonderful things that he is doing in the village of Harlem and for our students here at Metropolitan College of New York. So I welcome all of you, and I'm sure that this will be a very important conversation that we will have this evening. So thank you again, and I pass this back to Phil and to Professor Dominic Boyce.
Thank you, Humphrey. Before I introduce Dominic, allow me to give you all an overview of the flow of this webinar. Following the introduction of the panel, Dr. Julia Yassera will present. She'll present about a 12-minute presentation. Both during and after her presentation, we encourage the audience to use the Q&A feature to raise any questions that we will pose to the panel, and we hope to address most of your questions. Natalia, do you want to explain a little bit how to use that Q&A feature for the audience? You need to unmute.
Sorry. Hi, everyone. So the Q&A is different from the chat. This is where you will put in your questions. The chat is not really, it's only going directly to panelists right now. The Q&A is right next to the raised hand. So that's where you locate it. And then it just works exactly like chat, but it's a Q&A.
Very good. Thank you, Natalia. So Dominic Boyce is MCNY's longtime valued adjunct professor. He's chair of New York's NAACP Health Committee. He's also associate director for the Maternal Child Health, New York City Health and Human Hospitals. And he's done numerous webinars on this topic. And again, we greatly appreciate, Dominic, your work in arranging this amazing panel. So I turn it over to Professor Boyce.
I thank you for the gracious introduction. I want to thank all of you guys and gals for being a part of this wonderful evening. The goals of this evening is to speak from our experiences and to share, and educate, our audience, particularly around COVID-19 and the vaccines. And this is important. I myself was a member of New York City Health and Hospitals Strike Force team. So I've been a part of the command center dealing with the pandemic since early March. I myself lived in a hotel in Midtown for more than a month. So I've seen it up close and personal. I've seen the military, 3 of the armed forces embedded in the public hospitals. I've experienced, firsthand at Harlem Hospital over 300 deaths, in the spring. And, I was the one that took the phone calls in the command center from doctors and nurses who were crying and in tears, as well as having many of our staff in ICU. So I knew early on that this was real, was not fake, and that we needed significant help from the federal, state, and local levels to get through this. When you only have 10 ventilators in a house and you have, a hospital that's normally 270 beds, now 600 plus patients, you realize how critical the need is for PPEs and equipment. So I want to thank and honor all our healthcare heroes who are on this call with us now for your work and your service. So let's give them a hand and everything like that, because it has not ended for any of us, but particularly for those who are on the front lines. They continue to work hard. And I'm just thankful that we have this opportunity, through my various families to intersect. My Metropolitan College family, my NAACP family, which I've been working hard for, and you hear a lot from my co-chair, Ms. Aaliyah Dumas, soon to be a medical physician. But again, it's important that the intersection occur tonight with my Columbia family, my MCNY, my Omega family, as well as my NAACP. So I'm thankful for that. And I'm not going to belabor the point, because I want to turn it over to the experts, the subject matter experts, so we can hear from the various perspectives. As I said earlier, we have, clinicians, on this panel. We also have pharmacists. And this, for me, I'm honored because this is my first panel where we have a pharmacist, which is very integral to the vaccine pipeline. So we'll hear from her shortly and everything like that. And we have the up and coming, medical student who is on the way, whose education has been interrupted, but she continued to serve in the various facets, not just through her school, but also with NAACP to get out the health information and PPEs alongside myself. So again, I thank Professor Newfield. He's been my partner in this initiative from the very beginning. So I thank you. And so at this particular time, I want to move forward and introduce Dr. Julia Yassera. And she's key to this panel tonight. So I'm thankful that she's here. She's by training, she's an internal medicine physician, but she's also the new founder and vice president of the Dalio Center at Columbia University for Health Justice. And so I'm gonna turn it over to her right now. We can learn more about that wonderful work she's doing.
Thank you so much. So it's a pleasure to be here this evening and talk a bit not only about my personal experience as a physician on the front lines of COVID-19, but also about the work that I do now in the Dalio Center for Health Justice at New York Presbyterian. So I will give a short presentation about some of the basics of the vaccines, but we really want to leave a lot of time for you to ask your questions. No question is off limits. We really are here to help support you in making a decision. And so that gets me to my first and really important point, is that no one should feel coerced into being vaccinated. We all come to these conversations with different histories, with different backgrounds, with different experiences. And particularly in Black and Brown communities that have been disproportionately affected, that have been marginalized, that have historical reasons to distrust the medical community, we have to be very sensitive to questions and concerns and to really open the conversation and say, we are here to support you to make a decision, not to tell you what to believe. I myself was vaccinated in December. I was one of the first tranches and received Pfizer, because Pfizer is what was available to me at the time. And although I know we talked about some photos being available of people being vaccinated, you won't see my photo anywhere being vaccinated, because I was crying at the time, because I was so relieved to think about a future where we didn't have to see people dying, a future where I could be in the hospital and not worry that the next person I took care of wouldn't last through the day. So I was vaccinated, as I said, with Pfizer, but I really truly believe the best vaccine is the one that is first available to you. So my sister is a physician. She was vaccinated with Pfizer. Her husband's a physician. He received Moderna. My mother, who was recently eligible, and I'm so excited she was vaccinated, received Johnson & Johnson. So I practice what I preach. All of the vaccines are excellent, and I'll take you through how they were created, because some of the questions we get is, how did you make them so quickly? So bear with me while I just pull up my slides. I'll take you through a little bit of the vaccine timeline in a short overview. So first of all, I told you why I was vaccinated. I was vaccinated to really think about a future where we all felt protected, where we really were saving lives, where I felt like I could hug my mom and I could visit my family again and not have to worry. So we ultimately protect yourself with vaccination, but we protect our community and our families. And when we're starting to think about how can we end this global pandemic, the way forward is through vaccination. So when we think about protecting ourselves, I don't put these numbers up here to startle you or to scare you, but they are true. So as of now, we have had over 550,000 deaths in the United States from COVID-19. I don't think people can really conceptualize that number anymore. It's so high that it's just become, every day we see that number ticking up. But these were people's mothers, their fathers, your brothers and your sisters. They were your family members. They were your neighbors. These are people that we respect and we love. And so when we think about how do we make sure that that number doesn't go higher, again, it's through vaccination that we can really turn the tide against COVID-19. So a lot of times we hear people saying, well, I'm young, I don't have a lot of medical conditions, why should I be vaccinated? Well, COVID-19, what we've seen is that it can cause a lot of long-term problems, and we're not fully sure why just yet. There's some theories for why this occurs, but we've seen that people have long-lasting kidney problems, heart problems. There's something called brain fog that people are experiencing, where they don't feel like themselves. They can't think as quickly as they used to. We're seeing blood clots, and also for a lot of people, we're seeing long-lasting lung issues. These are all things that we can prevent through vaccination. And COVID is indiscriminate. We see these long-term problems in young people, in older people, in middle-aged people alike. We also think about protecting our community. as you know, and as we will talk about, the vaccine is not yet available for children. Studies are underway to think about 12 and under and their eligibility for vaccines. There are also some people who can't yet be vaccinated. Either they're not eligible based on the current criteria, or, and this is one of the only true contraindications to the vaccine, they're allergic to a component of the vaccine. So they cannot become vaccinated yet. So in order for us to get to a place where we can protect those that can't yet be vaccinated until we can get to a community immunity, it really takes all of us. It really takes all of us to do this sort of as a community service to protect each other. So do the vaccines work? And I used to have a slide up here that talked about all the individual vaccines, and I showed the statistics and the numbers, and I walked through it. And ultimately, we came to the same place. The answer is yes. These vaccines are incredibly effective. I only differentiated earlier between Moderna, Pfizer, and Johnson & Johnson because I wanted to tell you specifically that I emulate that with my own family, that I truly believe the best vaccine is the one that's available to you. But from here on out, I'll really talk about them as one. So when we say all of the vaccines, it's Moderna, Pfizer, and Johnson & Johnson are highly effective at preventing COVID-19 hospitalization and death. And ultimately, that's what we're most concerned about. We're most concerned with making sure that we keep you out of the hospital, that we don't have to worry about turning a hospital from 250 beds to 600 beds, to thinking about how we have to use our ventilators. We really want to protect and save lives. So is it safe? Yes. These vaccines were tested in studies in tens of thousands of people. That's actually, when we think about randomized controlled trials, when we think about clinical trials, these were large numbers of people that were studied in the original trials. But we also know now that over 56 million people in the United States alone have been vaccinated. And we have reporting systems, we also have monitoring systems available. So we know that these vaccines are incredibly safe, that the side effects are mild, and that any adverse reactions are very rare. So here's a big question. How did we get them so quickly? Because you've heard that traditionally vaccines take years or more to create. So how did we get a vaccine from start to finish in 1 year? Well, I think it's really important to say that it wasn't just 1 year. These vaccines were based on decades of research. And I'm going to say that again, they were based on decades of research. The vaccines, Moderna and Pfizer, the research to develop their mRNA vaccines, the research to create that started in the late 90s. The vaccines that we see in the way that Johnson & Johnson is created, we've had many similar vaccines just like that. So Moderna and Pfizer vaccines, the Zika vaccine, which we didn't use in the United States really, was made the exact same way. For Johnson & Johnson, Ebola vaccines and others made in the same way. So we have history using these types of vaccines before, and we had the research that was necessary to really be able to accelerate the timeline. So a traditional vaccine timeline looks something like this. I've already told you that many years of research already were done. But we took the testing phases, so the phases of those clinical trials, and we overlapped them. They understood, however, that if there were any concerns at any stage in the process, the study would have to be stopped and we would have to evaluate it before restarting. Additionally, production and manufacturing of the vaccines started early because they thought, if we're able to use these, we don't want to wait months to make sure that after we've completed all of the testing, if they don't work, if there are safety concerns, we'd rather throw away the vaccine than have to wait and potentially not save lives. And also, I'm sure everyone has had some experience with the red tape of government. You've all had to do your taxes and think about how challenging sometimes that can be. Well, now all of that is taken away. So we all are focused on really doing one thing and doing it well. And that's getting a vaccine from start to finish as quickly as we can and as safely as we can. So everyone is now focused on making this happen and making it happen quickly. But I think it's really important to recognize that no safety standards were skipped. They all were followed. It's just that we had more time, more attention, more eyes, and less red tape to cut through to get things reviewed. I think actually it was someone told me that usually you wait and batch all of the data. So once phase 1 is done, you batch all of the data and you send that to the CDC or the FDA. They were sending data in real time. So as they were getting data, it was going to the office for review. So there wasn't that time lag that we normally have. So is this vaccine going to hurt your community? I hear a lot of people worried about, will this vaccine get into my DNA? Will this vaccine give me coronavirus? The answer to both of those questions is no. And I'll say it again, these vaccines cannot give you coronavirus. They cannot give you coronavirus. They cannot change your DNA. They cannot change your DNA. And they are the best way to protect your community. The vaccines were tested in diverse populations, both in terms of racial and ethnic diversity, as well as diversity in terms of medical conditions. So people that had underlying heart disease, people that had underlying kidney or lung disease, because it's really important to know, will this vaccine work in a sort of target patient population, which is all of the United States. It's also really important to know that, that a diverse scientific community came together. I know a lot of attention has been paid to Dr. Corbett because she's phenomenal and amazing and was really leading the charge for one of the vaccines, Moderna. But I personally know people who were helping to lead some of the sites in New York City. I know physicians who were in the actual studies. This truly was a Herculean effort to get diversity into the studies at all levels. So a number of people have asked about the new variants that are popping up. And so what really is a variant? Well, as coronavirus, as it spreads, as it goes from one person to the next, it has an opportunity to mutate. It has essentially an opportunity to change its form a little bit. And what we're seeing in these new variants is that that spike, the little spike protein that we see on the circle, has been mutating and changing. One of the best ways to prevent this from happening is to prevent the ability of coronavirus to keep spreading in the community. So through vaccination, we stop the spread of coronavirus in general and stop the ability for it to mutate. I do have to say though, that what we're seeing right now, there's now a double variant or a double mutant that we saw in Northern California. We've seen South African variants, UK variants, and these are of concern because our biggest worry is that if we leave coronavirus spreading continuously in the community, will we get to a point where the vaccines don't work anymore? Right now, we have a golden window of opportunity. Our vaccines still work. They still cover these different variants. And it's an optimal time for us to really get the vaccine into as many arms as we can to really prevent this newer variant from taking hold. So there are a number of resources to make appointments across the city. We have our own site at New York Presbyterian at the Armory, and you can access that through Vaccine Together, ny.org. The state and the city both have sites as well. But it's going to take time to get everyone vaccinated. It's not something that we can do overnight, as you've seen. So it's still very important that we wear our mask, we wash our hands, and we watch our distance. Even if you are vaccinated, you still need to wear a mask and wash your hands and watch your distance. I wear a mask every time I leave my house. The only time I take my mask off is if I'm in a small group in my home with other people that have been fully vaccinated. So I know there are a lot of questions. I'm going to leave a lot of time open to answer them because I have an esteemed panel with me. If there's not a number of questions, there are few questions that we get asked quite frequently. So I'm happy to just throw out some more information if we need. But we have put a COVID vaccine education center up at New York Presbyterian. The website is nyp.org/COVID-19 vaccine. There you can find a number of short videos which talk about the vaccines. They talk about the variants. And we also have frequently asked questions. The frequently asked questions are in about, I think, 6 or 7 different languages, and all of our videos are in English and in Spanish. So I really welcome people to join and see what the information there is as well. As always, you can go to the CDC website. It has a tremendous amount of information about the coronavirus, and they keep it up to date. And it is actually a central resource for all physicians, clinicians, and everyone when we start to talk about coronavirus and the various vaccines. So with that, I'll say thank you. As I said, we know you have a lot of questions, and so we'll be here to answer them.
Thank you, Julia, for that incredible presentation. I think if you all click on the Q&A feature, you'll see we already have one question from Nakia Thompson. Nakia contracted COVID twice. So she's had some, if you read her question, she's already dealing with some long haul effects. And I think, Julia, you probably answered one of her questions, but let's go to the points that she made here. Will I have a bad side effect after being vaccinated? Does this vaccine affect me from having a child? I don't have children yet. Which one is better for me with this information that I gave? So I'll ask Julia and our panel to address Nakia's points. Then we'll go to Nicole.
So first of all, I'm sorry that you had COVID and had such a rough course. I think that's exactly what we're seeing is that people have some long-term effects from COVID. There's been some recent data and editorials to show that some that have these long-term effects actually get better after vaccination. We're not entirely sure why that is, but it may be because of the immune response that you generate from the vaccines. We actually do recommend in our healthcare system that even if you have had COVID-19, we still recommend that you're vaccinated. And it's for exactly what I showed. There's new variants that are popping up. There's also, we are not sure how long your natural immunity lasts after you've had COVID-19. So we are studying it in real time with the vaccine, so we will know how frequently you have to be vaccinated. Right now, it looks like the vaccines are good for at least 6 months, but they're going to continue to study the blood samples from those that were in the trials for us to know, do we need booster shots? Do we need to have another vaccine? Usually the side effects after vaccination are mild. My partner was just vaccinated with his 2nd dose yesterday and has been keeping me up to date with what his side effects are. He's only had a sore arm, which is what I had as well. Most of the time we see fatigue. People can have low-grade temperatures, although that's not quite as common as the arm pain, the fatigue. Some have reported some nausea, but generally symptoms resolve within 48 hours. In terms of the last question about fertility, there have been absolutely no links between the COVID-19 vaccines, any of them, and any changes to fertility, both fertility in men or women. So, and this is coming from the American College of Obstetrics and Gynecology, from the CDC, from a lot of very reputable resources who have said there is zero link between any effect in fertility and the vaccines. So the recommendation, if you're planning to become pregnant, and I say planning because the recommendation is slightly different if you are pregnant, but if you are planning to become pregnant, you should be vaccinated with your eligibility group, just as everyone else.
Okay, I think you answered that question regarding having children on your points made on DNA, the impact on DNA. But let's go to Nicole. And again, if we haven't answered your complete question, Nakia, we can come back to you.
Dr. Newfield, can we move to Dr. Phillips. I want to go around the panel.
Yeah, absolutely. Please do that.
On each one.
Yes.
And so just quickly for the members of the audience, Dr. Jadan Phillips, is, a good friend of mine. He's been working hard, out trying to help the community, but he's also the Associate Dean for Minority Affairs at the Stony Brook Medical School, the Renaissance Medical School at Stony Brook University. He's also a member of the New York State COVID Vaccine Equity Task Force. He's the vice chairman of the Omega Psi Phi Fraternity International Committee. Every week he hosts a weekly COVID-19 call throughout the 5 states in New York, New Jersey, Pennsylvania, Delaware, and Maryland. And so he's another, soldier in the fight against COVID. And so at this point in time, I'd like him to speak on these questions that was asked by the panel.
Well, again, I think I'm honored to be here. Dr. Yassera, great presentation. Really appreciate, your ability to move through all of that and to touch on it with the necessary detail that's needed, because I do think that we're in a crucial phase of this pandemic. If we get up to a higher percentage, say 30% of our country being vaccinated, we can start to see some appreciable improvements. So I think it's critical to really, and what we're seeing is younger people being the more critical population as far as those that are getting sick with COVID, and the fact that the president has made us aware that after April 19th, 18 and up is, in position. So this is a critical moment to have this conversation, because as Dr. Yassera mentioned earlier, there's a lot of reason why people don't trust. Unfortunately, as you look at how racism is played out in America, the medical system has been a major, participant in that. They don't just say Black people are less intelligent without medical co-signature. So I think, again, we need to be on the forefront. As I tell my friends, this is a Super Bowl for doctors. If you don't feel, the draw to get involved in this, then, this is what you'll have to talk about when people ask, what did you do during the pandemic? Personally, I'm from East Elmhurst, Queens, New York. In March, April, and May of last year, my neighborhood was the epicenter of the world. My family's been in my neighborhood for over 50 years. And I can direct you to at least 15 people that I know personally that died. My experience as a family doctor, I have inpatient practice, outpatient practice that I've been involved with during this pandemic, have experienced that fatigue that Dr. Yassera mentioned earlier, as far as the fatigue that medical professionals are experiencing. And you know how it affects us. Instead of it being Dominic Boyce in the door, he's patient 202 door. And when it starts to become that personal, that compassionate approach is starting to be lost. In addition to that, coming from a community where I didn't have any doctors in my family before me, I didn't have any people that went away to college, so I did not have individuals that were people that I could say, well, how did you go about going to medical school? And when you are a big Black man in New York, especially growing up in the 70s, 80s, and 90s, it really was difficult to find people willing to be mentors for you. So for me, this time, even though I've been discussing disparity and inequity in medicine as it pertains to people of color, the COVID pandemic, in addition to being all those damaging things that Dr. Yassera just mentioned so eloquently, it has also been an opportunity for those of us that understand the mission to talk about disparity. Because again, one of the reasons why communities of color like mine have been heavily impacted isn't just because people choose to have diabetes or choose not to go to the doctor. There was a big situation where you have communities that are what they've termed medical deserts. And what that means is these communities don't even have adequate medical care. My best friend's father, who raised me growing up, the family made a decision with him having COVID or dementia when he was exposed to COVID and was getting sick. And Elmhurst Hospital was not allowing any visitors. they decided to try to ride it out at home. So every day after I got off of work, I had a virtual rounding list, which was people, because again, coming from communities like mine, W.E.B. Du Bois talked about the talented 10 and those 10% of individuals of color that were able to be exposed to education and the responsibility of us to bring that information back to our community. So again, in doing that, I was in the position where I had to see this happening. As Professor Boyce just mentioned, we have the Omega Psi COVID Task Force. We've been meeting every week for the past 56 weeks in a row. And in doing that and in being approachable, you get people calling you all day long. One of my very good friends, he got sick with COVID, unfortunately, after a trip. And when he came back, he gave it to his whole family. And as he was seeing himself get sick, he connected me to his wife. And then the very next day, he was in the ICU. And the day after that, he was intubated. And each day, I spoke with his wife, three-way, to the doctor, and we talked about how he was doing and that they were throwing the kitchen sink at him. And the other thing that we experienced was, unfortunately, some of the biases that occur in medicine. We can talk about Dr. Susan Moore, who was the Black family doctor in Indiana that knew what was happening to her. And unfortunately, because she stood up for herself, because she wasn't getting the right care, she was labeled as intellectually intimidating. And that was the excuse that was used. So with these different experiences that I mentioned, I have unfortunately seen the intersectionality, as other people on the panel, of this pandemic. And as we talk about the vaccine right now, which is critical, we've also got to talk, because we are that talented 10, about how do we change the circumstances in our community that a Dr. Facebook is a more trusting person than a Dr. Yassera or a Dr. Dumas. And that, unfortunately, is part of the context of this conversation. Because I think it's easy for us to just, talk about the numbers, talk about the pandemic. But unfortunately, the other part of it is the experience that all of us have had has also colored or influenced how we listen. I use the example, like if my wife and I were going on a trip, say we had a trip to go to Puerto Rico tomorrow or the next day, and we had this big argument today. If we don't straighten that out, we're not going to be able to have a good time on our trip. And even though the numbers and the severity of COVID is significant, their history of or legacy of mistreatment, double standards, all of those things are influencing how people listen to the medical information. And that's why I think it's also important, Professor Boyce, that you get individuals that look like these communities. Because again, one of the things we've talked about on the COVID task force is initially what we were seeing is, hey, we got the vaccine. People weren't getting the vaccine. Why weren't they getting the vaccine? Because we were trying to bypass or skip aside some of the PTSD that people of color have in the United States. And we, as we talk about this pandemic, have to be able to lean in and hear and speak to some of the culpability that the medical profession has had as far as creating some of these circumstances. We haven't always been such where a patient can feel that the doctor is listening to me. It's great that we have this technology, but the other part of the technology that I've seen as I teach my medical students is the lack of interpersonal techniques that are used to create rapport. And again, as we start to have this conversation very intently, because again, as Dr. Yassera just said, if we don't vaccinate, these variants are going to run amok. And what we've seen in other areas of the world is the delay of reaching that threshold leads to, unfortunately, an environment where the variants can thrive. And unfortunately, what can also happen is they can even adjust or change in a way where these vaccines don't work anymore. And we are seeing now that with the warmer weather, with the COVID fatigue and mental health ramifications of this pandemic, my wife DJs and plays house music. So the other day, some friends of hers that we know, they had a party on St. James Place in Brooklyn in Bed-Stuy. If you saw the videos of that party, bumper to bumper people from Stoop across the street to the other side of the street, people packed. And you can get angry and say, what the H are you people doing? But unfortunately, we've got to also look at, these are natural reflexes that people have. So what I try to do now, instead of getting down on people about traveling and, wearing and not being as diligent and being safe in safe situations, is, think about how else you can protect yourself. Because the other thing that has come up at this point is, when we growing up, we don't really start to think about others until you say in your late 20s, maybe, 30s, you still can be thinking about yourself. But unfortunately, what COVID has made us all have to recognize is we got to start thinking about other people. Because in New York, especially in my neighborhood, we have people that live in multi-generational households. And I know if I pulled up on my mom's with my kids, my mother's letting me in the house. So we've got to understand those reflexes that we have, the desire to want to get out, if we got to go to work. Because a lot of times the people of color that are suffering, as Dr. Nufrio mentioned, they are in the got to category. I got to take the 23 bus. I got to go in and out of this apartment building that 200 other people live in and take this elevator or stairs every day. I got to work in this space where I can't work from home. I'm very fortunate. I'm blessed, and I recognize that. And I recognize that my situation is definitely not the norm for most. However, in us cultivating an approach, a message, we've got to be compassionate to those situations and circumstances. Because the thing that I have noticed is people are getting frustrated. As a medical doctor, when I see people running in the street without a mask on, because I've been in the hospital and I've seen a man and a woman that were married for over 65 years that were in the house, and after Thanksgiving, they got sick. And then as the mother died after 4 guys 2 days ago, the son is allowed in the room, and now he's confessing to his mother's nonverbal body that I just wanted to see you, Mom. I didn't mean to bring this to you. And his parents who are in the house are dead. So I've seen that, and I've seen people that are tired be afraid, lack the compassion. So again, I think it's also for us healthcare professionals, young Dr. Dumas, we've got to be intentional in making sure that we stay rejuvenated, because this is a tiring process. We're not at a finish point yet. So again, in addition to us being at that point where we got to consider taking this vaccine, because as Dr. Yassera said, again, as we say in Queens, if you make a decision, you got to hold that. So if you decide not to get the vaccine, like I have friends that are like, look, I don't trust it. A patient that came in that said that, and this patient, he didn't think about it. I said, didn't you tell me that your grandmother lives in the house with you? He was like, yeah. Don't you work at Sing Sing prison? He said, yeah. I said, well, maybe the prisoners are not throwing feces and urine right now, but I bet you they coughing on you. So how long, especially in light of these variants, do you think that you can go and not get COVID? Because as we've seen with the question, people can get COVID multiple times. So we've seen situations where individuals initially may have had mild COVID episode, but later on, if they were reinfected, person died. As Dr. Yassera just mentioned about the long hauler situation, we do a monthly webinar, and Professor Boyce, you join us. We're actually having a woman in this upcoming session at the end of the month who, again, she went to Southern University. And if you're not familiar, Southern University is a historically Black college in Louisiana, and it has one of the greatest marching bands in the world. And this woman was one of the dancing dolls. And then after she recently graduated, she was professionally dancing, and she got COVID last April, and she can't even walk around the blocks right now. And again, this is the type of unpredictability, because this was a healthy person. And in most cases, we would think that that person would be all right. But with the unpredictable nature of COVID and the aggressive nature of these variants, how do you know that you won't be the one? So
Dr.
again,
Phillips,
yes, sir.
how do you address some recent reports that folks have contracted COVID after receiving their second dose?
Well, again, I think, Dr. Yassera mentioned a word when she said vaccinated, when she talked about her family, which is fully. I had a friend of mine who got his vaccine with his wife the Friday before Palm Sunday. And he went to church on Palm Sunday. And then on Tuesday, they both had COVID, even though they both got vaccinated. Another thing to be mindful of, it takes 2 to 14 days to develop symptoms of COVID. So say Monday, Dr. Nufrio, me and you were hanging out and doing something we shouldn't be doing, and we get exposed to COVID, but I have an appointment on Wednesday to get my shot. All I'm asking when you're coming to get your shot are a series of symptomatic questions. And if you pass those, you can then get your shot. But however, say, as most people between day 5 to 7, you start developing symptoms. So you could have, again, been vaccinated, have been in that window of being exposed to COVID, and then after being vaccinated, still be exposed. So I think, as Dr. Yassera mentioned earlier, it's important that we understand what fully vaccinated means. Because a lot of people, again, a favorite movie of mine is Old School. And you remember when the character got drunk and he became Hank the Tank. I think you got people now who are running around thinking, I'm vaccinated, so I'm good. And as the CDC has said, non-essential travel is not recommended. And with these variants, you can still be, because again, the vaccine prevents serious illness and it prevents death. It also can lower your risk of infection, which is recently shown, but it doesn't prevent 100% infection. So theoretically, even though you might not be getting sick, if you're not practicing safety measures, you could give COVID to someone else. So again, there's some circumstances where you could be vaccinated and unfortunately still get COVID.
How about if we move on to some other questions that Dr. Phillips and others can answer? Nicole Davis indicated, are all the vaccines mRNA based? And she also said, do any of the vaccines require an annual application?
I want to move to Dr. Powell to answer that question, since she's the pharmacist on the panel. She's also the site director for pharmacy operations at New York Presbyterian Hospital, the #4 ranked hospital in the nation. And she's also the past president of the New York City Society of Health System Pharmacists. And she's the first African-American president of the New York State Council of Pharmacists. So I would like to bring on Dr. Powell to speak to these issues about vaccines.
So first, like Dr. Yassera, I want to say that I got vaccinated at the first opportunity that I could get vaccinated. And I got vaccinated in December, and I got the Moderna vaccine. But any vaccine that is available to you, you should take. They're all very good vaccines and will help us. And I can talk to you a little bit about it. But I think you wanted to know one of the things that we were most proud of. I'm most proud of that we have this mass vaccination site at New York Presbyterian, where we vaccinate between 3,000 to 5,000 people every day. And as the pharmacist, we are responsible for ordering those vaccines, and we never run out. We have loads of vaccines. Getting those vaccines there, assuring the integrity of the storage of the vaccines. And we pull up each and every dose of the vaccine to make sure that people are vaccinated appropriately. And I can tell you a little bit about the vaccines. So there are several vaccines available right now. The Pfizer vaccine works on a messenger RNA, and that was in Dr. Yassera's presentation. And it's good for people greater than 16 years of age. And in order for this vaccine to work, it takes 2 doses, and the doses are 21 days apart. So I heard someone talk about getting COVID. after having the vaccine. Remember, the vaccine does not protect you 100% from getting COVID. In terms of the Pfizer vaccine, we believe it to be about 95% protection for you. But even if you got COVID and you've had the vaccine, your disease would be less severe. So it's not 100% effective, and you can still get COVID. That's why it's important that we still wear a mask and that we still socially distance. The next vaccine that's available is Moderna. Moderna is the one that I got, and it's another messenger RNA type vaccine. And right now it's approved for ages 18 and above. This vaccine also, you have to have 2 doses, and it's 28 days apart. And it's about 94% effective. And you develop immunity about 14 days after you've gotten this vaccine. So if you got the vaccine today and you went out and did, like Dr. Phillips said, something that you shouldn't have done, like maybe had your mask off, drinking or eating together, you're not fully protected. So after the first dose, 14 days, perhaps you get about 50% protection. But then the second dose, after another 14 days, is where you get to the 94 and 95% protection. The third vaccine that's available right now is the J&J vaccine, and it does not work like these other 2, which are messenger RNA. It's an adenovirus vector. So if the vector vaccine is a modified version of a different virus than the ones that cause COVID. And so this virus vector goes inside the cells and gives it instructions to make a protein that's unique to the virus that causes COVID-19. And using these instructions, immunity comes about. So right now, we only have 3 vaccines available. The Pfizer vaccine, which is messenger RNA, the Moderna vaccine, which works by messenger RNA, and J&J vaccine, which is an adenovirus vector. There are 2 that are being used outside of the country that may become available in the US. And one is by AstraZeneca. I think that's probably close to coming to the US. And right now that one's good for people 18 years and above. And it's also gonna be 2 doses, 4 to 12 weeks apart, but that's not here yet. And there's another one very close to coming to fruition, and that would be Novavax. And it has a whole different way of working. It's recombinant. But the AstraZeneca vaccine that we don't have yet has the same mechanism of action as the J&J vaccine, which is an adenovector vaccine. So those are the vaccines that are available right now. I'll also, as the pharmacist, will re-emphasize that the COVID vaccines are safe and effective, and you may have side effects, and side effects are normal. And some of those side effects you get in your arm would be pain or redness and swelling, which goes away in about 48 hours. I didn't get any side effects. My husband got it, he didn't get any side effects. My daughter got it and she didn't get any side effects except maybe a sore arm. Throughout the rest of your body, you might experience tiredness, headache, muscle pain, chills, fever, or nausea, but it goes away within 24 to 48 hours. So that's my viewpoint as the pharmacist.
Nicole Davis asks, will any of these vaccines require an annual application?
We don't know yet. We're still studying. We don't know how often we will have to give these vaccines yet. Those studies are still underway.
And Dr. Yassera, you were going to address the question, are all vaccines mRNA based?
Yeah, that's
Yes, So I just wanted to really quickly put it out there. So Moderna and Pfizer are mRNA-based vaccines. The Johnson & Johnson vaccine is actually a DNA-based vaccine. So the adenovirus vector is just really the coding that piece of DNA is in. And the mRNA-based vaccines are in a slightly different coding. But ultimately, they all work the same way, which is that it delivers a message to your body. So DNA, mRNA, it's just a way to tell your body, make a protein that looks like coronavirus. So they do it slightly differently, but ultimately it's the same idea. It's a message in a bottle. The bottle is a little bit different, but the message says, make the protein that looks like the spike on coronavirus. And that's actually why we can very safely say you can't get coronavirus from the vaccines, because they don't contain any coronavirus. They contain a message, and they use your own body's ability to make proteins to make the protein. After it delivers the message, the vaccine dissolves. You don't have it anymore. After the protein is developed, it actually doesn't stay around that long either. And all you have left are the antibodies that your body made. That's what you get that's left as your immune memory. So, there are 2 mRNA-based vaccines and then 1 DNA-based vaccine.
Along the same lines, Charles Gray asked your reaction to the pause regarding J&J's vaccine due to adverse reactions. But I also know that same issue occurred with the AstraZeneca vaccine.
I think it shows that the system works. That's exactly what it was designed to do. And in fact, I showed you when you put the timelines together, the whole idea was that there's a million eyes looking at the safety. And if anything happens, they pause, fully investigate. They make sure they do not think it was related to the vaccine. And that's exactly what happened both for Johnson & Johnson and for AstraZeneca. They paused, fully evaluated, was found to not be related to the vaccine, and then they restarted the trial. So I actually think it's exactly what the trials are designed to do, and it makes me feel more confident about the safety because the trial was paused. Everyone had to evaluate the data before it could be restarted. And listen, my mother got Johnson & Johnson. If you don't think that I don't believe in a vaccine, you're not going to let your mom take it. So I was very supportive of her getting Johnson & Johnson.
Right. You know,
I just wanted to jump in real quick with the Johnson & Johnson. I think another, thing to think about is it's very convenient. So if you're a person, say if you work a job where you don't get time off and you just need to get, that might be something for you. Say if you're a person who has logistical difficulties, hey, it's hard, I can't travel, I can't get to the vaccine sites. That's another, population that'll be helped. A lot of times, as I mentioned earlier, in communities of color, as we saw the rollout of the vaccine early, Caucasian communities had higher access because they had the facilities. One of the things in difference between the three, starting from Pfizer moving to Johnson & Johnson, is the lack of storage requirements that are so stringent with the Johnson & Johnson. So like today, I'm doing Johnson & Johnson in my office. I couldn't do Pfizer in my office because you need to be -80 to -120 degrees centigrade. So again, that creates a lot of challenge. So the release of the Johnson & Johnson actually gives us a wider range of ability to reach those in areas that might not have the facility to have some of the other vaccines that require more stringent storage requirements.
Along those lines, we're talking about vaccines. We now have a divide in the country on a patient's right to choose, which Marion Bell is bringing up, discussing the patient's right to choose which vaccine they would prefer to have and how our facilities helping accommodate those informed choices. Very good question, by the way.
Well, and my response to that would be, one of the things that have dictated the release of vaccine to this point has been supply. So we're not at a point like a soda machine. You could say, you know what, I want a Sprite. Nah, I'm gonna take a Sierra Mist. We're not at that point. There may be a time, and with these additional vaccines that Dr. Powell mentioned, that are coming down the pike, the AstraZeneca, et cetera, they will give us more supply, which would give us a little more versatility. So as I said, then you are in a position that you've got to look at your own personal logistics and see which of those make a best fit for you. Because again, someone who has a busy schedule, Johnson & Johnson might be the way to go for them. So again, I think with more vaccine available, that choice will be there. But I think right now, as both Doctors Yassera and Dr. Powell just said, the first vaccine is the best vaccine.
And I wanna second that, because one of the things I do, I oversee a vaccine part or center for the city, and I'm also authorized schedule for multiple sites across the 4 to 5 boroughs. And just yesterday, I had a restaurant worker who forgot about his second shot. And so I get a lot of those calls. I forgot. So to Dr. Phillips' point about the convenience of the J&J, the one dose, it does add things, because one, in addition to being just one dose, two, you don't have to have that specialized freezer at that low temperature and everything. So that's important. But I also wanted to pivot to Leah Dumas, who's also a panelist here, and she can speak to the earlier question one about, she received the Pfizer vaccine and everything too, and she can also talk about this hesitancy, because what we have seen, or what I'm seeing, is that some people will show up to the vaccine center and storm out upset because they wanted Moderna or they wanted Pfizer, and they didn't have it available when they showed up. And, again, the point is, you get the one that's available to protect yourself and your family. But people are actually, and this includes clinicians, will actually, like doctors, nurses, they will not get it because they wanted Pfizer or Moderna. So I want people to have a takeaway that you get the one that's available to you. That's going to protect you. And we got to shift to Aaliyah now.
Thank you, Dominic, again for having me here. For those of you that don't know, I'm actually a current second-year medical student at the CUNY School of Medicine. It's a 7-year Bachelor's of Science and MD program. I actually was supposed to be going into my 3rd year last year, but my family had some complications. My dad actually thought that he had COVID, and it was around me studying for step 1. If Dr. Phillips and Dr. Yassera knows how stressful step 1 is. So I made the personal decision, since I am living at home, to take the year off, to also get right and be with my family during this time, because I do have a lot of older individuals in my family who have comorbidities, cancers, everything. And like Dr. Phillips said, I live in a multi-generational home. So I felt it was safer for me not to put them at risk, because at that time there was no vaccine, and I would have been going into the hospital religiously every single day. So with that being said, I also am a vaccine scheduler as well. And I realized from the past few days from scheduling individuals, I tend to get now, in the beginning, I was helping out a local church near my school, City College, to schedule people. And a lot of the older individuals were asking for the Johnson & Johnson. And I believe that's because most of them don't have like transportation to take them to multiple appointments. It is just more convenient, like Dr. Phillips said. But then as the guidelines have lessened to be for 30 and plus, and then now 18 and plus, I'm getting a lot more people in my age group in their 20s and in their 30s asking to be vaccinated, looking to be vaccinated. And it's actually interesting to see the shift from when the vaccine came out in December in my age group to now, because I'm starting to see that more so people in the age group up to the 20s to their 30s are wanting to get the vaccine more so compared to before in December. And I think that's partially have to do with the COVID fatigue. I feel like a lot of them are tired of staying at home. They want to get outside, and they're also like, what can they do to lessen their chances of getting COVID again, or exposing their families to it as they begin to get hot outside and go outside. So yeah, I think, what was the other question? Sorry.
And about the patient's right to choose and everything like that too.
Yes. So, but as everyone has said, it's definitely best. I always tell them it's best to get a vaccine, any vaccine that they can get, rather than waiting for one that's more convenient for them. Unless it really is a hassle for them. And recently, I've been like, even though the vaccine scheduling website that I'm a part of only have for Pfizer and Moderna, I have been like actually trying my best to go out and find them for Johnson & Johnson if I can, because I know that a lot of them are still worried about it, especially the older individuals.
I see that there are two people in the audience, Gary Jenkins, who's the commissioner of HRA in New York City, and Bob Zaza, who's a leader in the ambulatory care movement. It's one of the first persons in the country to open up ambulatory care centers. I was wondering, when we open the mic up, maybe Gary or Bob would want to ask a question. Also, Pam Ramson, Dr. Ramson, asked a question that I thought maybe we would address. And her question was, what is your view about how safe it will be in larger groups in New York City by the fall and winter if a person is vaccinated? Are they preparing for mass booster shots in the fall?
So I think if we look at what's been happening across all of the manufacturers, they're testing booster shots now. And so I think that, it's very hard to be able to say what will happen in the fall. I think we've seen that President Biden has been advancing eligibility rapidly. And so which was, I think the latest that I heard is that April 19th, everyone is now eligible. And I think that that's really in a push to get people vaccinated as quickly as possible to mitigate the variants. But, it really depends on all of us. So if we all get vaccinated quickly, if we really abort the variant from taking over, then I think the fall could look very different. If we don't, and if people are really lagging in vaccination, and if we unfortunately have a newer variant, then we may have something that looks slightly different in the fall. I think we're all quite hopeful, but I think unfortunately it's far too early to predict what would happen in the fall of this year.
Okay. Hey, Natalia, do you think we can open up? Some folks are showing their hands. I think they want to ask some questions via the voice feature. Are we ready to do that and post some questions to the panel based on some hands that are raised?
Hillary had a question, so I'm going to open up for her.
Victoria, you're on mute. You're muted. Maybe she needs to unmute.
Okay, yes. Hello?
Yes, we can hear you.
Okay, yes, good evening. I graduated from Audrey Cohen College. That was the name long ago. But my question is, first of all, why isn't this vaccine like a permanent vaccine like polio, measles, mumps? Why is it only maybe lasting for 6 months? That's one of my questions. The other one is, this is about my son who was 49 years old, who died in a nursing home in February of 2020. And this is just a question, not about a vaccine, but I just wanted to know that if he actually had COVID. The doctors were saying because COVID wasn't in New York City until March, they could not diagnose him with COVID-19, even though he had all of the signs. There was a big outbreak at this nursing home where everybody was basically on IVs on his floor. And my son had a serious problem with breathing. And the night before he died, he could barely breathe, but they told me he was okay. He died the next morning. But then a few weeks later, that's when the COVID came out. And I just feel that that was what he had died from, but they're saying that they cannot put that on his death certificate because COVID-19 was not in New York until March 2020. I just want to know, is that so? Can you answer me that?
Well, as far as the second part of the question, at that time, because we have a nursing home on our site at Stony Brook, and we lost about 250 people in the springtime of last year with COVID, because we were in the midst of a pandemic, as you saw with some of these hospitals having a trailer outside, what that means is that the medical system's being overwhelmed. So the detail that you would expect normally, an autopsy, those types of things, they weren't happening then because people were just trying to deal with what is going on. And I think that, what we saw at that time, especially in the nursing homes, was that they were being overwhelmed with what was happening. And with that being overwhelmed, I mean, a nursing home is not the most populated as far as staffing type of place. They try to operate it with as least amount of staff as is safe. I think that unfortunately was the perfect scenario. I had a patient who passed in the spring of last year, and she's an older woman, had multiple medical problems, and unfortunately, because all of the specialists were closing in late February, early March, she had 2 other medical issues that came before the colon cancer that they found. And again, this pandemic has really dictated to us, unfortunately, how intense we can manage other aspects of medical care. And this is another reason why it's important for us to get it under control, because you got people not only just not getting an autopsy in these circumstances, but you've also got people who have other medical ailments that may need hospitalization. And because of the medical system being stretched, they don't really have the facility to handle these very regular problems. And unfortunately, even though that person may not have died from COVID, COVID did have a role in it because it influenced their medical care. So I hope, Victoria, and I'm so sorry for your loss. I hope that answers your question, your second part.
Thank you.
I second that. I'm very sorry for your loss. And I can take the first part of your question, which was about why isn't this like polio? And I will show you that it's probably closer, more like to a flu vaccine, which we do use every year. And that's really just driven by the type of viruses that they are. So polio virus doesn't mutate in the same way that coronavirus does. And I think that's why we liken it a little bit more to like a flu, where every year we have to get a flu vaccine because the flu is it's like a different model that year. And so the scientists do as much as they can to figure out, well, what type of flu do we think we're going to have this year? And that's the vaccine that they develop. Coronavirus is very similar. The type of virus that it is very prone to mutation. So when I showed those pictures of the ball with the spikes on it, what we see that's mutating a lot is those spikes. And that's what's needed to get into your cells to cause an infection. So when we're testing boosters or when we're thinking about having a new vaccine, a lot of it is driven because the virus itself changes and we have to change what's in the vaccine to be able to cover the new variant of it. But polio really only, there were like, I think a couple different strains of polio. So you really only had to have one vaccine. But the other thing that was really important about the polio vaccine is that everyone got it. So everyone got vaccinated and you got polio out of the community very quickly. It was nearly eradicated. And so I think that's where you see that yes, there are 2 different types of viruses. One mutates a little bit more quickly than the other, but also in terms of a public health protocol, everyone got vaccinated against polio and you got it out of the community so that it didn't have time to mutate.
I can almost see a
Thank
scenario like the polio vaccine, because I received the vaccine in school in the 50s. I'm revealing my age here. But
Yeah.
we could almost see that would be the scenario of, having a booster, an annual booster that our schools will probably play a significant role in this, which could mean that our schools now are going to have to increase staff regarding nurses at these various schools. So, we may have to develop a whole infrastructure around inoculating kids, in our school districts, just like we did with the polio vaccine of the 50s.
And also,
Thank you.
just Victoria, because you brought up measles, I also think it's something that we've been, that I actually was talking about earlier today for our pediatric population, because it still requires that we keep getting vaccinated. So one of the childhood vaccines is MMR. So we vaccinate all kids against measles because we want to keep it out of our communities. But we saw that there have been outbreaks of measles. Even though we thought it was eradicated in the United States, we sometimes see outbreaks of measles because we don't have enough vaccination in that area. You may remember a couple years ago, there was an outbreak of measles. I think it was in Brooklyn, in New York.
Yes.
There was an outbreak I think there was an outbreak in Chicago or Philadelphia more recently. And that's because we have to keep vaccinating to keep it out of the community. So, I'm very hopeful that we can really attack coronavirus in the same way that we thought about measles vaccination and polio vaccination, vaccinate everyone as quickly as we can to get it out of the community. And then perhaps we won't really, it's possible we can envision a time where we have to get a booster, but then after that, we may not have to for a little bit longer. We just really don't know yet.
Yeah,
Right.
Dr. Powell, would like to add anything?
I think Dr. Yassera covered it all.
Bradley Hawk had a question on the Q&A. Bradley, do you want to ask your question to this panel? Natalia, could we give Bradley voice access?
Yes, sorry, I fell behind.
No problem.
There we go.
My question was basically directed to whether or not, if you are fully vaccinated, if your antibody test will come back as positive.
Should.
I'm happy to take that one. Well,
Yeah,
so
it should come back. I mean, after 2 weeks, you should have, adequate immunity. So you should have a positive IgG test at a certain level after 2 weeks after the second or the first 2 weeks after the first J&J vaccination. Go ahead, Doc. I didn't mean to cut you off.
no, I just want to add one other little part to that, though. So if you're in the clinical trial and they're studying a very specific antibody that they actually have the test for, then yes, it'll be positive. But the tests that we do at different places actually pick up different types of the antibodies. So it's possible, even if you're vaccinated, the test that a certain hospital center or an ambulatory care center, it may not pick up the antibody. And it's just because of the type of test that they do, because they're all a little bit different. So it doesn't actually mean anything. If you test negative after you've been vaccinated, doesn't mean you don't have immunity. If you test positive, it doesn't mean your immunity is better. It's just that the type of test that you got may not be the one that picks up that specific antibody. So we actually don't recommend that you test for antibodies after vaccination. That's exactly why we have the clinical trials, is because we can see that, how many people in clinical trial develop immunity. And so then there's no need for you to test afterwards.
We're almost at the 90-minute mark. So if anybody has any unanswered questions, please raise your hand and we'll address that. And when we close out, I'll ask Dominic and maybe the panelists to help out with the closeout on this.
Okay, let me see the chat.
Natalia, are there any raised hands?
I'm not seeing any questions, no.
Okay. I guess maybe we can wrap up. Dominic and panel, you want to make any closing remarks before we end this session? And the recording, I think, will be streamed via our social media through MCNY.
I'm going to pivot to Aaliyah Dooms. I just, as part of close, I want her to talk about the work she's been doing specifically with the NAACP around the vaccines. And then we're going to go to Dr. Powell, Dr. Phillips, and we go with Dr. Yassera.
So as becoming recently the co-chair with Dominic for the Mid-Manhattan Branch Health Committee, we have hosted a panel, I would say late February, with other physicians discussing with our branch the COVID myths and scarcities about the vaccines as well. Then together we have been able to become vaccine schedulers to help individuals in the community gather access to vaccinations. And so far, along with Queens branch of the NAACP, we have been able to vaccinate almost 100 people, I believe, or more, as well as give access to seniors for transportation back and forth to and from the vaccine sites, as well as give them access to it. So.
Dr. Powell.
So I'd like to end with emphasizing what Dr. Yassera said about 500,000 people dying from the COVID-19 virus. It is a serious, serious disease. Again, hundreds of thousands of people have died. And as a pharmacist working in the hospital, I've seen that death firsthand. I want to re-emphasize that a vaccine is a proven and safe way to help your body fight off the infectious disease of COVID-19, and that the CDC recommends vaccination as the first and best way to protect against COVID-19. So I encourage everyone who's listening to get the vaccine, and any vaccine that you can get is good. So please get whatever is available to you. Encourage your family, your friends, your colleagues. We should all get vaccinated. I got vaccinated for my family, for my colleagues, for everybody in the United States. The only way we're gonna beat this COVID-19 is that we all get vaccinated.
Did Dr. Phillips, as part of your closing, just quickly, you can touch on herd immunity, because that's an issue that many people don't understand or term.
So with the term herd, well, first thing I want to say is this. Aaliyah, salute to you, young sister. Again, to sacrifice your career, not sacrifice it, but put it in a holding pattern to support your family. That's what a doctor does. So the medical profession, once you get across, is going to be really a much better space when you are part of it as a full-fledged MD. So again, I am now part of your village, young sister. And if I can be of any assistance, please don't hesitate to reach out. And I pray that your family continues to get through this in the safest and healthiest way possible. As far as herd immunity, again, imagine if we're in a room, a closed room, and there's 20 people in it. And, of that 20, say we have 17 people that are vaccinated, and within that 20, there's 3 that are not. And the way that the vaccine or the virus travels is it goes from one person to the next person to the next person. So if you've got 17, 18 people vaccinated in that room of 20, for the virus to reach those individuals that are not vaccinated, it's not going to be able to do it because it doesn't have conduits, because people have either been vaccinated or they have had COVID. If you had that room and say only 3 people were vaccinated of that 20, that virus can move around like a ping pong ball or pinball and hit up everybody. So again, what we're trying to get at is to get 70, 75, 80% of this country to be vaccinated. Because once it is vaccinated, then we're at that point where the virus doesn't have the oxygen like a fire to continue to move around and spread. And unfortunately, as it continues to multiply and spread, it can also mutate and cause further variations, which could complicate things such as not making our vaccinations work as well as they have thus far. So again, getting to that point of herd immunity. And as Dr. Powell just said, it is not about me. It's not about Dr. Powell. It's not about Dr. Yassera. If we all get vaccinated, our young people, Aaliyah, she's going to be able to get back into school. She's going to be able to resume her medical career, you know, because the other thing that we're seeing is the intense emotional and mental impact of this virus. There's some people, they're not going to make to get to college. They're not going to get to grad school as they once planned on doing because their career was interrupted by this pandemic. And unlike our young sister here, they weren't able to pivot. And that's not by their choice. That just, unfortunately, is the circumstances that we've alluded to throughout this talk, which is disparities. But again, if we all get vaccinated, then we put ourselves in a better position. And the last thing I would say, as a person who partied in New York back in the day, and for some of a certain age, I remember going to the Paradise Garage coming from college, and the line was way around the corner. And I had this one friend, he would always be, we'd get up there in front of the line, he had to run to the store or run to his car because he forgot something. This is not the line you want to jump out of, y'all, because if you jump out of line with bad information, you know, make the information relevant information. Also consider how your circumstances are impacted. So if you do jump out of line, you could miss that spot because they may not let you right back in at the same point. And with these variants, we are seeing that there is a higher level of infectivity of people being able to be infected. So again, as a New Yorker, as a 5-borough New Yorker, how long do you think that you can navigate where you're going every day in the city and not get exposed to COVID? Or better yet, if you're a young person like the soon-to-be Dr. Dumas, you know, who wouldn't necessarily get sick, how do you prevent it from spreading to the ones that are more vulnerable that you love? So again, the vaccine decision shouldn't be just about yourself, because you've got to think about how it affects you, how it affects your family, how it affects your community, how it affects our country. Because again, nobody's going to get back to normal business if this pandemic stays in the space that it is in presently. So again, y'all, make sure you make that decision and make it with good, sound information. As we say on the Omega Sci-Fi calls, or each one of us, even though you may not be a Dr. Yassera or Dr. Powell or myself, you can all be COVID ambassadors. Because again, if I went to Philip Nufrio's house, even though I know what I'm talking about, because his family knows him and trusts him and are familiar with him, they're going to believe him. So we all have to be able to relay this message of importance to all of our villages. So again, with that being said, great opportunity to present with such incredible panelists. I thank you so much for the opportunity, and good night.
Thank you. Dr. Yassera, last but not least.
No. I think I'll just go back to what I said at the very beginning, that being vaccinated is a personal decision, and that our goal in providing information and in really doing these panels is to help support you in making that decision. My hope is that everyone feels the way I did when I was vaccinated, which was such tremendous relief and hope. And I felt as though we really had a way and a path forward. I felt that we were doing this for not only our communities, but for myself, selfishly. So, you know, that's what I really want for everyone, to really feel that same sense of, you know, really seeing the light at the end of a very long and was but a very devastating tunnel. So thank you for your time today. And I'm happy if there are any other questions, you know, you guys can send them my way and I'll get answers for you. But thanks a lot.
Thank you. And I just want to say, as part of my close, that what everyone said, but most importantly, it's about protecting our collective villages and everything like that. We have an intersection tonight of my village, and as a result of that, what I've always said to people, not just about COVID in this pandemic, but just in general, epidemics, whether it's from back in the day with STD, sexually transmitted disease, Ebola, HIV. It's a pandemic or epidemic of your networks. So it's about protecting your network, and it's always about the strength of your network. So as the analogy Dr. Phillips said about getting out of line, there's certain lines you don't want to get out. There's certain you don't want to be in. But in this particular case, in terms of vaccines, you want to add another tool in your arsenal to protect yourself with the social distance, the face, the mask wearing, now it's double mask wearing, the hand sanitizing, soap and water. The vaccine is to complement all those things so that it can protect you and those in your family and your village that are more vulnerable to you, because not everybody, we're all different generations and everything, but we interact with each other. And this virus is invisible. So you cannot look at a person and say, hey, this person has it or she has it and everything like that. So again, this is about being a COVID ambassador and spreading, knowledge and educating our communities, because we know before COVID, there were disparities and comorbidities, particularly in Black and Brown communities, and they will continue to be. But our job is to lessen, the death and devastation that is being wreaked and reaped across these communities. I mean, personally, I've lost more than 20 people, including 2 people, my neighbors in my building, many friends, church members, and everything like that. So to me, this is personal. And so I'm trying to save, one life at a time by having people getting vaccinated. And so this is not my Super Bowl, but I have passion for it because, my background is in public health. And like I said, I can see the difference in people's lives. And I just thank MCNY, the NAACP, and the Columbia family for participating in this educational panel. And again, thank you all. To my partner, Dr. Nufio, to Vice President Crickendale and President Pizarro. Kudos and thank you. God bless.
Thank you.
Thank you again, everyone. Be safe and please spread the word within your community. And thank you, Natalia. Humphrey, do you want to have a final comment? You may have to unmute yourself, Humphrey. Humphrey, you have to unmute yourself.
Thank you again for the panelists. This has been so vitally needed for our communities, and I can't thank the panelists enough. The only thing that I would add to this, and it has nothing to do with the subject matter that is at hand, but Dr. Phillips, you should know that you provoke some of our guests with your reference to Paradise Garage. And now many of them are longing to return to that time and place. We are not there and we are not going back there. We are pressing forward. And I don't believe that the Paradise Garage is even in existence anymore. Dr. Yassera, thank you so much for your information. Dr. Powell, thank you so much. Thank you. Metropolitan College is indebted for your valuable knowledge and information that you have shared with us this evening. Thank you so very much.
Good night, everyone.
And thank you, Natalia, who brought it all together.
Thank you, Natalia.
Thank you. It's amazing.
And everyone have a safe and enjoyable evening and stay safe and mask up. Thank you.
Yes, thank
Very
you.
good. God bless.
Good night.